You can go live, Rupashri.
Yeah. Good afternoon, everybody. We at Hetero Healthcare welcome you to our PET program. As children learn to walk and talk, they also begin to learn about their bodies. However, the concept of sex and sexuality is still a taboo in India. This is because nobody talks about it in schools or at home, and there is a lot of awkwardness when the topic is brought up. Sex education is a topic many parents would prefer to avoid. A clear, progressive sex education can do a lot of good things in improving children's self worth, build respect for each other, and make them realize that sex and sexuality are very normal part of life. Today, with us, we have Dr. Vilona Annunciation, who will discuss on important and sensitive topic of sexuality awareness and communication. Dr. Vilona is a young consultant psychiatrist working at IPH Thane. Dr. Vilona has done her MBBS from Grand Medical College and JJ Group of Hospitals, Mumbai. She did her MD in psychiatry from Father Muller College, Mangalore. She works as a consultant psychiatrist in Institute for Psychological Health, Thane, and Prafulta Center for Psychological Wellness, Andheri, and Hiramungi Navneet Hospital, Mulund. She is certified as Level 1 in Jeslet therapy methods. Dr. Vilona is an excellent communicator and is known to develop excellent rapport with her patients. She likes to interact with variety of people in her journey as mental health advocate. She combines her medical expertise with her extrovert personality to dispel the myths and prejudice against psychiatry. So today it's indeed our pleasure to have her with us. She would guide us in communicating with our patients on sexuality awareness and communication in children. So, Dr. Vilona, over to you.
Thank you. Thank you, Rupashri, for that fantastic introduction and for that very important note about the topic that we're going to cover today. So let's begin with our subject for today. And before I begin, I'd like to share my presentations. Yeah. Yeah. So today we're going to be talking about the awareness and communication on a very sensitive yet very crucial topic, that is sexuality. Uh, when this topic comes up, the first question that arises in everybody's mind is, we know what sex is, we know what sexual interaction is, but what is sexuality? And I often ask this same question when I sit down for my workshops with the preteens, with teens, with young adults. I also do the sexuality session for the marriage preparation course in my church for young couples planning to get married. And I often ask them this question: what is sexuality? As it is, the topic of sex is a little bit of a taboo all around us. Parents are absolutely comfortable talking about what is right, what is wrong, discipline strategies, how to manage. But when the question of talking about sex and sexuality comes up, there is a lot of confusion, there is a lot of nervousness. Parents are often not sure whether they are saying the right thing, doing the right things. And so today we're going to try and clarify some concepts and try and understand what are the basic levels of information that need to be imparted to children of different age groups, as well as how to handle this communication. So to start with, what do we mean by sexuality? Sexuality is not just the expression of our physical or biological sex, or it is not just the way we feel attracted or the way we express our sexual interest in somebody else. Sexuality is actually encompassed by an entire wheel of different things. So it includes your body, the way you think and feel about your body, the different factors that come into play about your gender and your understanding of your gender, the way you interact with, the way you respond to the different relationships that you have, your interpretation of how people connect with you and how you connect back with them, and the values and beliefs that guide this thought process. So it is actually a amalgamation of your genetics, the personality factors that you are growing with, and also the learned behaviors that you have seen among your family, among your friends, the discussions that you have among people around you. So the sexuality wheel actually encompasses all of these things. And yes, we do sex education for children in schools, but we do not address all of this. And that is something that we need to talk about and we need to start thinking about. Because, like Rupashri mentioned at the beginning, it is an important aspect of the growth of the child. And we need to look at how we can address this concern. So, when we talk about concepts regarding sex and sexuality, we need to address two areas. One is the individual's own experience of sex and sexuality, and also the way they express that sexuality in a social setting, in a group of individuals, or within their social environment. So, both their experience and expression would encompass the concepts of sex. So, what does our sexuality include? Our sexuality includes the thoughts that are related, the emotions that are created in us because of that. And as a result of these thoughts and emotions, the various behaviors that we engage in. Okay. So we look at a whole dynamic interaction between thoughts, emotions, and behavior that goes on from the time the child is small to the time the child reaches preteens and teens and then grows into an adult and continues into the adulthood right up to the old age of the person. So I put down this slide because our concepts of sexuality have changed since the time we were kids, right? When we were kids, the thought was that it's only about male and female. But now there is no such binary division. What we have seen in actual practice and in actual interaction with people is that there is a diversity in the way humans experience and express sexuality as well as their sexual orientation. So, if you look at what we used to term as gender identity, that is whether a person identifies them with themselves as either a woman or a man. Gender identity looks at how you think about yourself. So, whether the person identifies as a woman, genderqueer, or a man, gender expression would be how you demonstrate your gender, how do you express that gender to the outside world, and it could range from feminine to androgynous, right up to masculine. Biologically, the sex is determined by the different organ systems that we have, the hormones, and of course, the chromosomes which make up the genetic material. And this defines whether or not we are female, intersex, or male. And finally, the sexual orientation. So, what we look at in terms of our sexuality with a physical, spiritual, and emotional attraction. So, whether it is heterosexual, whether it is bisexual, or whether it is homosexual. Now, in actual practice, I have seen that it ranges on a spectrum. So, while we thought of it as two discrete identities, as male and female, or heterosexual and homosexual, we are now seeing that it could range along a spectrum, right? So we could see biological females identifying more with the male sex, wanting to change the physical attributes to the male sex, as well as wanting to live their life and express their genders as a male. So we see a complete variation along the spectrum from male to female. And I think this is one of the concepts that need to be understood and need to be thought about in a very clear, non-judgmental, and a manner which is aware and comfortable. Because a lot of times I get this question when patients are referred to me or when patients come to me in the clinic. And very often the question is, Doctor, can I check with you if you're queer friendly? And I always think and I always hope that we emerge into a space where every doctor that they reach out to is queer friendly. Because I feel that if this is something that they are coming to us with their concerns, uh, as part of their treating physicians, we should be in the position to be able to help them and support them through this. Understanding that it is not anymore binary will also help in addressing the queries and concerns of parents, because very often parents come to us with, can you change them? Can you do something different? Can you treat them for not wanting to identify with the gender that they're born with? And as we very well know, we can't obviously treat it or we can't obviously change that, but we could help the parents come to terms with the change that they have to cope with, which is quite a struggle for them, given that their concepts that they grew up with are now being seriously challenged. So, when do we actually become aware of our sexuality and our gender? um, this thought did not really strike me till I was interacting with my kids, and my younger one is a boy, the older one is a girl. So while my older one was born before 2 years before him, and when the younger one was born, the first time she saw him passing urine without his pampers on. She just looked at me and she said, Mommy, that's different. That's not what I have. And I said, yes, you're absolutely right. That's not what you have. This is what boys have. And that's the first time that I realized that children as young as 1.5, 2, 3, when they see their siblings, when they see people around them, is when they actually realize that their bodies are very different from the bodies of the opposite sex. Most of us have had this awareness when we were growing up. Most of the kids that come to our OPD will also have some degree of awareness of whether or not they are male or female. And the degree of awareness and their understanding of their sexuality will vary with the age. It is therefore important that we understand what signs to look for and how to address the concerns when they come to us. Uh, the concepts of childhood and adolescence and adulthood, when it comes to sexuality, keep changing. Sexual development is something that we need to look at in terms of the growth and the milestones that the child is achieving. So, as we look at gross motor milestones, we look at fine motor milestones, social, language, we look at all these milestones. Let's also take a look at what are the concepts of sexual development and what are the milestones that they achieve along the path of sexual development. So, their first emotional attachment is with their parents. And in infancy, this bond between parents and children is promoted with a lot of physical contact because babies are held, they are touched, kissed, hugged, cuddled, they're tickled. They are allowed to express a lot of their emotions because of the physical contact that they have with their parents. Okay. Now, this unique bond, this unique intimacy that parents and infants have is a very important part of their foundation of physical intimacy. It's important that children go through this aspect so that they understand the feeling of warmth, the feeling of being protected, the feeling of being loved that they experience when they are with their parents. And this can later be a part of their development into mature sexuality. So a lot of times we get parents who come and ask us questions about the child touching their genitals during diaper changes, or at times the baby boys may have erections while the diaper is being changed. Now, this is absolutely and perfectly normal. And we usually just reassure the parents that it is absolutely normal for the child to want to explore and understand the sensation that is associated with that touch or the sensation that is associated with that feeling. So there is nothing to worry. It is just important that at that point of time, the parent should have a calm response and not get very panicky or very anxious. The facial expression is one of the biggest cues, and this is something that I tell most parents, that when your child comes to you and your child is going to come to you with some shockers of stories, when they come to you, please be calm, respond in a calm manner, because that first response that you give registers in the child's brain, and once it is registered, the child learns accordingly. So, for example, if the child feels that my parent is not comfortable with this particular topic, with this particular subject, the parent doesn't even have to say it with words. If the expression conveys it and the child is convinced, the child will not open up again. And so it is important that we as parents or we as doctors explain that when these topics come up or when this thought comes up, you need to be calm, you need to be patient, you need to understand that this is the child's curiosity about their body and it's absolutely okay and it will pass. By the age of 2 or 3, the child starts developing a sense of whether or not they are male or female. And this is what we call as gender identity. So they also start expressing this in the kind of clothes they wear. Of course, this is all chosen by the parents. So now there is a shift into using more gender neutral clothing and not influencing children with the thought process that, okay, only boys can do this or only girls can do this, which is good. But at their 2 to 3 years of age is when the child is slowly developing some concepts when it comes to understanding their body and their identity as a male or as a female. They also start identifying with gender roles. So, for example, smaller children, you will see them looking towards the same gender role parent. For example, a female child would look towards a mother, the male child would look towards the father. And you will see this imitated or expressed in their play pattern. So, imitation of gender roles through play could be one way of assessing whether or not the child is able to understand the concept of their sexuality. Then we move into the next stage, that is, between 3 years to 5 years, where the child is in preschool. Here, they have a strong sense of whether or not they're a boy or girl. And at this time, they might start exploring their bodies more purposefully. So at this time, it is very important not to make them feel guilty or shameful or uncomfortable about their body exploration. Okay. But it should be clearly mentioned that even though touching the body or, trying to explore private parts feels good, it is something that must be done in a private space and not in a space where there are other people around. So this is a very important concept because it starts teaching the child about privacy, about the concept of my body in my space, and nobody else is allowed into that space. So this is also a good time to start the concept of good touch, bad touch with the children. It is, an extension of the privacy. So if you teach them about privacy, then the next step about good touch, bad touch becomes an automatic translation. At this age, the kids are also very, very curious. So there are endless questions. Where do babies come from? Why does my sister have the same body parts? And all of these questions need to be answered. Now, it's difficult, I understand, but they need to be answered honestly, matter of factly. And if you feel that there is something that cannot be answered or is not developmentally appropriate, you can tell them that, okay, this is not the time when I will discuss this with you, but tell them when you would be ready to discuss it with them. So you don't just shut the topic, but you open the door to another discussion later on, and you tell them that right now you are not comfortable bringing the topic to them. Responding with fake concepts like, for example, children are sent by God, or the stock bought them, or we got you from the hospital, just adds to the confusion. So it's not a good idea to respond with false information or fake information. There is no need to go into elaborate detail. So you don't need to explain in detail what all is happening, but at least a basic idea. So one of the things that I did with my kids when they were about 5, 4 and 6, I think, was that I read this book to them called Amazing You, Getting Smart About Your Private Parts. It's available easily on Amazon online, and You could either get the physical book, or you could encourage your parents to get the ebook and read it with the child. It's a fantastic book because it tells you about all the body parts, uses the correct names, no hoo-ha and he and none of that. It is very clear about the expression of body parts, and a very simplistic explanation of how humans interact to produce a baby. So it's very important to answer the questions when they come, because if the questions are unanswered, children will look for solutions elsewhere. This is also the age when they explore each other's bodies. So children may find time to sort of find alone time to pull up clothes, pull down pants, check what's the body part, what's happening. And parents sometimes get very panicky and very anxious about this. It is important at such a time to talk to the child. It is important to talk to both the children that were engaging in the behavior and explain to them that this is not okay, and that their own body is their private part, and they need to be very careful about sharing that with somebody else. So this is a good time to have these discussions. Sometimes parents come with a little bit of anxiety about preschool attachment towards the opposite gender. So while it is very natural, because if they identify with some behavior or with some sort of emotional response, they might get attached to children of the opposite gender. And it may look like it's a boyfriend girlfriend relationship that's happening, but there is nothing to worry about because it will pass. It's just a phase. At this age, they are still very, very sensory motor in their development, and out of sight is practically out of mind. So it's okay as long as they meet the child and interact with them. That interaction will remain. When they move on to the next class, it will break. So there is nothing to worry there. A little older kids. So when they start hitting their pre-teens, around 6 to 10, this is when they need to be spoken about in an age-appropriate manner about how their body is going to change. This is a good time to talk about what puberty is going to bring about in terms of the body, what are the changes that you will experience, how your body and structures will change, and what it means when your body and your brain grows up. So this would be a good time to understand that children might pick up abusive words from friends and from exposure to TV, as well as exposure to other people around them. They may pick up inappropriate jokes. They may pick up inappropriate behaviors. So, at this point of time, it is important to start putting in some disciplinary strategies. So, what's okay, what's not okay? What happens if you do something that's not okay? What is the punishment for doing something that is not okay needs to be discussed and expressed to the child. They may also have very specific curiosity about the act of sex. And this is something that needs to be addressed. As they grow, as they mature, from adolescence right up to adulthood, they will keep reading up, seeing the changes that happen in their body, talking to friends, watching videos, seeing through various platforms, media, that there are different things that are going to happen. The idea is that if they're already initiating conversations like this at home, the child is more likely to grow up having a very healthy idea about sex and sexuality, about not that it is something taboo and it is something bad and it is something shameful and guilty, but that it is a part and parcel of life, but it is one part of life and it is not everything. It comes with your academics, it comes with your work, it comes with your responsibilities, it comes with your extracurricular, so everything has to be balanced. It is very important to have this steady development with kids, because unless they get this continued development, they might struggle with their concepts of sexuality, and they might learn concepts of sexuality from their friends who might not be able to give them the right concepts. This is something that I wanted to mention, that curiosity among kids, and you know this better than I do because you see them every day and you see that they're curious. They want to know everything, what's happening here, what's happening there. They want to poke their hands and fingers everywhere. And it's absolutely natural. And it's wonderful that we have these bright, children all around us engaging in curiosity. But some amount of curiosity can be a little bit of a danger. So, what do we think is natural and what do we think is a little concern? Okay, so at small ages, that is right from 2 years up to 6 or 8 years, touching, even to a certain extent, masturbating in a public area or in a private area might be noted in some children. Trying to look at sibling or other peers of the same group, trying to look at or trying to touch their genitals, showing their genitals to peers or sibling, standing or sitting too close, or sitting in such a manner that their genitals are touching somebody else, trying to view adult or peer nudity. That is, for example, peeping while the sibling is taking a bath, or looking through the peephole while the child is changing in the bedroom. Now, these, if they are transient behaviors, and if you are able to distract the child, is completely natural, and there is nothing to worry about. But if it looks like the child is not able to restrict themselves, not able to get distracted, if it is happening too frequently, and when you try to redirect the behavior, the child is not able to redirect it. If in the process they cause themselves or somebody else emotional or physical pain, or if there is a component of cruelty attached to it, if they are mimicking adult sexual acts, then these are red flags that this curiosity is not just curiosity, and it's beyond that and needs to be addressed professionally, medically. We have trained therapists who work with children, because we've had a number of cases that have come to us with, either an older child abusing a younger child, or two children of roughly the same age engaging in physical intimacy that was not age appropriate. And we have intervened in terms of play therapy, in terms of medical treatment, as well as parental counseling, to ensure that all the concerns are addressed for both, that is the victim as well as the perpetrator. We've seen from both the perspectives, and that is why I say that curiosity is natural, and we should do our best to understand whether it is just simple curiosity or whether it has gone beyond that to an extent where the child is not able to resist the impulse, or is repeatedly seeking gratification in a manner that is not appropriate to their age. So look at the curiosity, dig a little deeper, probe about the history, and that will help you understand whether or not this is happening. It's very important to have this discussion in a calm and clear frame of mind with the parent, because a lot of times parents might try to gloss over or avoid the discussion or the topic. So it is important to discuss it with the parent and tell them that unless they are absolutely honest with you, you will not be able to help the child to the best of your capacity. So that means you need to be absolutely prepared to deal with no matter what comes within the purview of sexuality towards you. It's important that as medical practitioners, we all look at this as a very vital aspect of our discussion. So I know that taking a sexual history is not something we do on a routine basis. But if you see that the child is extremely hyperactive, if you see the child has inappropriate development, you could probe about sexual behaviors in your history taking, because it will prepare you for the strategy that you have to plan to work with the parent, and to guide the parent then to the appropriate help. A lot of times, unless you ask the question, the parent will not share this detail. So it is important to include this in your history when you are talking to the child and the parent. So why are we talking about awareness? Rupashi mentioned at the start that we are looking at healthy sexual development of the child, and yes, sexual awareness and sexuality awareness is an essential component of that development. Just like we look at, food, clothing, shelter as essential to our survival, sex is also an important part of our essential needs. Absolutely essential needs. So when we look at sex as such an essential part of our daily routine or our life at a particular point of time, it is important to see that our children are developing in the right sexual manner, or they are developing the right sexual ideas and concepts that would help them through their life. Awareness is also important because it fosters openness. Otherwise, we have a society that doesn't talk about sex, that doesn't discuss about issues related to sex, and comes up with problems only post marriage or only when conception or pregnancy become a challenge. It's also a fantastic way to ensure that the child and the parent that is interacting with you is learning about new concepts. And it is also a fantastic way to keep your knowledge updated about what's happening in the world. It definitely fosters and encourages healthy behaviors. So, talking about sexuality, talking about sex, makes it easy for a child to come and tell you that my friend was saying this, and I don't know if that's right, but I think that what he was saying is right. What do you think? So, it's important to encourage this healthy discussion within the family, and that is why awareness about sexuality needs to be encouraged. It enables children to get access to solutions. See, you and I have solutions that are available for them. But how will they know that they have to reach out to us if they think that they can't talk to us about this subject? So, when we talk about it, when we create awareness about it, we enable that they are able to reach to us when they need solutions and when they are looking for solutions to their problems. And of course, it fosters a very healthy relationship. A lot of the times when I see couples that come to me with marital discord, 3 years of no sex, 5 years of no sex, and there is so much of discontent, mistrust, lack of love in the relationship. We cannot discount the fact that as teens, as young children, they are building the foundation of their adult relationships. If we don't encourage awareness about sexuality, we are not giving them the option of a healthy adult relationship. And I think that's something that we need to work on. As Eckhart Tolle said, awareness is the greatest agent for change. I hope that as we work towards creating awareness about sexuality, we can look at a change in our society, in the environment that we are working in, so that children are able to talk about their problems much more openly than they are doing currently. So, what are the challenges that we face when it comes to communicating about sexuality? I can think of a whole lot of challenges, and I'd actually thought that we could do this in a more interactive fashion, but the current format doesn't allow us to do this. But the challenges are definitely numerous. The biggest challenge is right here in our own brains, right? Because the thought is that how do I talk about this? How can I ask this question? And believe me, I have faced this myself, because I have hesitated when it comes to taking a sexual history from a 50-year-old lady, or asking a very young teenager about exposure to sex. I have hesitated at the start of my career, and um, it is simply the will to want to be a better psychiatrist, looking at other psychiatrists, seeing how they have worked, that has motivated me to push myself beyond my comfort zone and ask the questions. And because I have done that with an open mind, it has become much easier now to talk to youngsters, to talk to teens, to talk to adults about any aspect when it comes to sexuality. A lot of times, the comfort zone is also with your own gender. So, for example, if there is a female sharing with me, I would probably be more comfortable. Vice versa, also, the patient might not be comfortable sharing with you. So, if it's a female patient, they prefer to discuss it with a female, or if it's a male patient, they prefer to discuss it with a male. So, I often offer them that option, that if this is something that is extremely private and very difficult for you to share with me, I can recommend a male colleague who will be able to help. And that seems to help and sort out the problem, because then they can go and talk freely. The idea is to remove whatever barriers are there in terms of communication. Then the challenge is our own preparedness and knowledge of the subject. Now, this, because of our medical training, we are in a uniquely blessed position because we have quite a bit of knowledge of the anatomy, the physiology, the entire biochemistry behind it, all the neurobiology behind it. So we can answer questions much better than most other people. But if we keep it purely technical, it will not be interesting. So it is important to water it down to their level, to use communication strategies, language that the child or the parent is able to understand, and mirror their way of, understanding, so that you are able to convey the concept in a simplistic manner. So my usual challenges that I have seen have been the internal discomfort with the subject, the gender specific discomfort, as well as the concerns with whether or not the correct information is being passed along. Also, there is this doubt and this challenge that a lot of parents come up to me with, that aren't we giving too much unnecessary information to the child? Like, is it necessary that the child should have this information? We didn't have this information and we grew up fine. So I challenge the we grew up fine, because I see that end of the spectrum, right? I see the not fine bit of mental health. And I challenge that. And I say that we didn't grow up absolutely fine. There were concerns. And we're not doing this so that the child grows up absolutely fine. There will be concerns with the child as well. The idea is to improve your relationship, to encourage the child to talk about it. So it is important to talk about this. It has never happened that talking to a child openly about this subject has created the curiosity in the child to go and seek more information about sex and sexuality. If the curiosity was always there, it's probably now unmasked. But it is not that talking to a child will actually create the curiosity in them de novo. So that's not going to happen, and that's not a worry that you need to concern yourself with. That is something that you can say to the parent to allay their anxiety. That if you don't talk about it now, it's very likely that the child will get the wrong information from somewhere else. So overcome the challenge of what if I'm too early, because today there is no too early. There are kids getting information based on sex and sexuality as early as 8 and 10. So our sex education that happens in school in the 8th and 9th standard is inadequate, not as informed as the children already are, and they know that they won't get all their doubts and questions answered properly. Beginning a conversation about sexuality early and continuing that conversation as the child grows, therefore, is the best sex education strategy that we can have. This is a model that has been adopted across some Western countries, even Australia, where they start conversations with the good touch, bad touch conversation at 3 years and continue it through the child's development in school. And that is why this entire concept of sexuality is something that we need to now take a re-look at and see how we can address and how we can help uh, promote the awareness about this concept. Now, as far as awareness is concerned, we all agree and we all know that awareness is something that is absolutely important. But how to communicate? And since communication is the key in this subject, how to express what is going on in our mind and how to enable the other person to be comfortable and to share openly whatever is going on in their mind, so that we can then address the queries that come up. So, to begin with, you need to remember two concepts very clearly, and that is the information must be age appropriate and you must deal the information in a piecemeal manner. Do not think that giving the child 1 2 hour lecture on sex education will be enough. That's not what we are looking at. What we are looking at is small packets of information. Let the child go, mull over it, think about it, come up with doubts, discuss with some friends, come back with suggestions and ideas, and then you lead the conversation forward. So you give information that is only age appropriate and only limited information, and encourage this give and take. So tell them we had this conversation. What do you think about it? And then they come up with their ideas and then you contribute to it. Someone very wisely said that we have 2 ears and one mouth. So we need to listen more than we speak, which is a very bad thing for me to be saying right now because I've been talking nonstop for the last 40 minutes. But still, we need to listen more and speak less when it comes to children. So we let them talk, we let them move forward in terms of expressing their ideas and their concepts, and we listen to what they're saying. And then we share our thoughts and ideas and discuss with them. So it flows like a discussion and not like a lecture or like a compulsory subject that they have to study in school. We don't want it to be like that. What are the simple do's that you need to keep in mind when you are having this conversation, when you're looking at having this conversation? So the first thing that you need to do is prepare yourself. It's not going to be the easiest conversation. It's going to be, it's going to throw up challenges. My kids are now 10 and 8, and I don't know when the first time, they'll throw a bouncer of a sex question at me, and I will have to, keep a straight face through it and answer very honestly, as possible. But I remember that I was taking this session for sexuality for preteens, and and these were preteens from across Maharashtra. We had invited a number of kids across the state to participate in a competition, and these were the kids who had won the competition, and they were all together at a camp, and I was addressing the topic of sexuality. And when we talked about sexuality, concepts about masturbation, concepts about body came up. Surprisingly, one child asked me about sex toys at that age. And that was a surprise for me because I did not expect that child to have the knowledge about sex toys. But I decided to keep a straight face and answer that question. So you need to prepare yourself that there will be some bouncers that will come, and you have to be on point to be able to answer those. It's a good idea to decide whether or not you're comfortable taking the topic. If you're not, then it's a good idea to involve somebody else who is more friendly, more comfortable with the idea of the topic of sexuality. Always encourage a discussion. So when we do the sexuality session, I'm not standing, or I'm not doing it like this where I'm speaking and the kids are all listening. It's not like this at all. We sit round in a circle and we throw about ideas and we share what is happening and what are the thoughts that are coming in my mind and what are the thoughts that are coming in their mind. And it's a lot of fun because when we do this discussion, a lot of strange and weird ideas come up, which can then be addressed very logically and very medically by me. It's important to keep eye to eye contact. A lot of times, when the topic is uncomfortable, please remember that our eyes will move to a comfort zone. It will move to our prescription pad, it will move to our apparatuses that are there nearby, it will move to the examination table, it will move up to the ceiling or down to our phone, and that's not okay. Because when you do that, the patient understands that you are not comfortable talking about this subject. So make sure to maintain eye to eye contact. Leave room for addressing doubt. I know that in a busy pediatric OPD with kids turning in and out with so much of illness, it might be very difficult for you to make the time for this. But maybe having trained staff who can do this with your kids, who can address these concerns, who can give them a little bit of time to talk about what is happening and address their doubts and questions might help. If there are any questions, answer absolutely honestly. If you don't know the answer, it's okay to say no. Sometimes they are really shocked. Doctor, आपको भी नहीं पता है. And I'm like, नहीं पता है. It's okay. So it's important to answer honestly and speak from experience. They absolutely love it when you speak from experience because they can see the genuineness, they can see the reality shining through. And they then look at you as a role model or somebody they can emulate. So speak from experience. And of course, make sure to enjoy the conversation because this is not a conversation that will get repeated very often. It's a conversation that is important. Make sure that you are enjoying the conversation. What you must not do when it comes to sex and sexuality, do not give a lecture. We're not looking at a lecture or a complicated discussion of the different body parts and the images and the diagrams, and you may have fantastic diagrams at your disposal. They will not be interested in that. Please don't use incorrect or false or pet names. That creates a very immature understanding of the body part. And it is very important that as children grow, they know that their body part has a specific name and they know what it is called as. So use the correct body part names. Don't avoid discussing difficult topics. So if the child is asking you for a discussion, don't keep avoiding. Or if the parent tells you that they want to discuss the topic with you, please do not avoid the discussion. Encourage the parents not to avoid discussing the topic. uh, Teach the parents not to criticize their child when they engage in behaviors that are sexually explicit, or when they express their sexuality in some way or the other. Tell them not to judge or blame the child. Every child is unique and every child has a different way of understanding how their body is growing. It's absolutely okay for them to take their timeline. What is not okay is for them to grow up with parents who say, you are useless, you're a loser, you cannot be thinking like this, you have no shame, you're always doing this. That's not okay. So teach your parents not to judge or blame the child, and that they need to stay calm and not get angry when it comes to discussions about sex. Very often, I have teen parents coming in and telling me that they found sexting chats on their child's phone, or they found, nude pics on their child's phone. And when I ask them, what did you do? The most common response is, हमने phone अपने कब्जे में ले लिया और उसको एक कान के नीचे बजाया. So it's a very common response that anger is just a very normal response for human beings. But that anger is not going to help promote that parent child relationship. So it's important to encourage the idea of staying calm during this discussion and not losing your temper and not getting angry during the discussion. So what kind of discussions can you have with children across the age? So for toddlers from 13 to 24 months, they should be able to name all their body parts, including their genitals. They should know the difference between male and female. They should have some idea that the body is private, and they should understand when and where it is appropriate to touch their body parts. So, for example, private body parts can only be touched when you're in the bathroom or when you're alone in the room, when you're changing your clothes. So, this concept needs to be spoken to the child at this time. They may not actually practice it because at this time they are hardly alone. Most of the time, it's the parent who's giving them a bath or dressing them or changing them. So, giving them this concept that it's okay for mama and papa to do it, or it's okay for mama and somebody else in the family who is a caregiver to do it, but nobody else. So, this discussion needs to be started. At least the conversation needs to be started. As they grow from 2 to 4 years, the basics of reproduction, uh, younger kids are more interested in pregnancy and babies. So they don't want to know the act of sex, but they want to know how babies are made. Okay? So one very way of answering this curiosity is, all mamas have an egg in them, all dadas have a sperm in them, and when the two join, then babies are made. So how they join together is one question that can come. So it needs to be answered by saying when they come close to each other, when they share their love with each other. So it needs to be expressed in an age appropriate manner without lying about the subject. They need to know that their body is their own and no one can touch their body without their permission. And this is something that as parents, we also need to encourage the concept of learning to ask before they touch someone else. So, can I hug you? Can I hold your hand? Can I put an arm around you? The consent needs to be asked for, and they need to ask for permission. So, this is something that we can teach them. They need to start to learn about their boundaries and about the privacy around body issues. And they also need to learn about the other body parts and their functions and basics about the different body parts that they have. Early school from 4 to 8 years, here where what we call as pre-primary and primary, early primary school, a basic understanding of sexuality and gender, They should understand conventions about privacy, nudity, respect for others. For example, at this age, it's a good time to teach the child that you cannot come running out of the bathroom without a towel. You have to have a towel wrapped around yourself. This could be a good time to start teaching the child how to use the computer and mobile devices safely. Given the pandemic, given how everything is online now, this is an important concept to discuss with the child. And around 4 to 8 years is a good time to start the talk. Basics about puberty, and these basics should ideally be done together. Boys and girls spoken to together so that they are asking questions that the other person might not think of. So they understand it from a holistic perspective. And understanding of human reproduction should continue. As they go into preteens, now their concept about sex, what is safe sex, what is contraception, needs to be addressed. Basic information about pregnancy, sexually transmitted infections. They also need to be told about relationships. What are healthy relationships? What are unhealthy ones? What are the warning signs of unhealthy relationships? They should be taught about internet safety, internet bullying, and sexting. And they should also start to have discussions about how the media, how advertising and the whole publicity industry looks at bodies and the way people look at their bodies. You may think this is a concept that is too early, but it is honestly not. I have a 9-year-old in my house now who's almost about 10. She'll be 10 in a few months' time. And some of these concepts uh, are already brewing in her mind, and she's already asking me questions about this. Kids today are very bright and very, very curious. So it's a good thing that we talk about it and help them understand that this is what the media says, this is what is projected. But you also need to understand that you have your own genetics, your own body structure, your own body size, and that's absolutely okay. That is you. You need to understand and accept and love yourself the way you are. So, this conversation could be had in the preteen age. And then we move to the teen years, where proper detailed information about menstruation, preferably before menarche or puberty, should be done with the teens. Detailed information about menstruation and nocturnal emissions, especially about wet dreams, pregnancy, sexually transmitted diseases, and about the different contraception options. Learning about how alcohol and drugs can impact judgment and what happens when you are under the influence of alcohol as well as drugs. Again, we emphasize the differences between healthy and unhealthy relationships. And teens, as a rule, are very private. You know, they won't share very well and they won't open up and talk to you unless they are comfortable. Sometimes it has taken me almost as long as a few months for a teenage patient to open up about something that they don't want to share with me. And that's okay because they are, as a rule, more, in into thinking and understanding what's happening with them and discussing it with their peers. So, with somebody older, it might be really difficult for them to engage in the discussion and to open up and share. Also, there's the worry that the conversation will not be taken the way they expect or might not be acceptable to the adult, and that can come in the way of sharing. So please understand that teens are private and they might not share, no matter how open or how comfortable you try to be. They might not be willing to share, and that's absolutely okay. But they should hopefully get into a space where they have a comfortable enough relationship with some adult who is able to discuss this with. We talk about some important concepts that is absolutely necessary for teenagers to go back with. One is sexual wellness. So it's important for them to understand what healthy sex means. We talk about what sexual intercourse means, but we don't talk about what it means to enjoy an active, healthy sex life. So, what does it mean? How do you express your concern for the partner? How do you express your concern for the fact that your partner is also enjoying the process of the sexual intimacy, and you are also enjoying it? How do you express what you want to your partner? How do you share about your physical health? And finding mutual comfort zones that you can discuss about sexual wellness. So, this is an important concept that we need to cover when we talk to teens and also parents of teens. Important concept about safety. What is the meaning of safety? What is the meaning of protection? Not only prevention of pregnancy, but also prevention of sexually transmitted diseases. So it is not only about using protection in the danger days, but also using protection throughout because you don't want to catch an infection. Understanding and taking into consideration preferences of both the partners. Looking and talking to a physician, a pediatrician, a gynecologist, your family doctor, your psychiatrist, whoever you are comfortable with, about what is recommended by the doctor as the ideal way to go ahead, and having a proper discussion about this. I think we're still at a phase where it's too early for me to expect that parents have this discussion with their child. But I see a lot of parents, especially in urban India, already looking at having the discussion with their kids, already opening up to the idea that their kids are not just kids, but also growing into sexually active teenagers, young adults, adults. So it's important to discuss the concept of safety. It's important to discuss about the concept of consent. So asking clearly, clear communication. Not that, she said this, so I thought it meant that I could put my arm around her. No. Clear communication, asking clearly, getting a clear response. The legal age of consent in India is 16. So understanding that the consent below 16 is invalid and there could be problems related to that. Potential for abuse, what could abuse mean? If they don't understand consent, they will not understand abuse. So for them to understand the concept of abuse, they have to understand the concept of consent first. So we explain to them about consent first, and then we tell them that when things are done beyond your consent or without your consent or in spite of your lack of consent, then it could mean abuse. So this is important. And also that when you are in a relationship where things are not going the way it is, then you need to open up and take help. Because unless you understand this, you will not reach out and take help. So talking about this is also important. Uh, one of the concepts, and this is one of my favorite concepts that I take with the teens that I interact with, that sexual maturity and sexual intimacy is definitely something that they consider a right. That I am 18 now, so I should be able to have sex, or I am 21 now, so I am of the legal age to get married, or now I can go ahead and have sex. But are you ready to face the consequences? Are you really ready to face the consequences? So, making them aware of the consequences, gauging their readiness to deal with it and face it is very important because it's not only a right, it comes with an attached duty. And this needs to be evaluated. How responsible is the child? How responsible is the teen? How responsible is the adult? Do they engage responsibly in their other activities as well? Whether it is studies, whether it is extracurriculars, whether it is relationships with friends and peers. Is there a sense of responsibility and a sense of, yes, this is something that I take seriously, and I want to, do this with an understanding of things going right and going wrong, and I'm willing to deal with whichever way it goes. So it needs to be evaluated when you're discussing with the child. We usually do it as part of our psychiatric history. So when we do an initial psychiatric history, we are able to gauge the maturity level or the not only intellectual but also emotional capacity of the child to make decisions. Sometimes it is a gray area, and there are assessments and evaluations that are available, psychometric tests, which can help us understand the sense of responsibility that the child comes with. So, this could be an important thing to discuss with the child. Please remember that for them, at their age, teens, children, young adults, they experience the emotion, and it is the emotion that they are expressing. So we don't discredit that, we don't ignore that, or we don't deny that and say, okay, no, but this is not important. We accept that this is what they're feeling and then move forward, because then the discussion might prove to be useful. This discussion about sexuality is a very, very private, a very emotionally charged, and a very bonding discussion. So I have parents who come to me with panic because their child has been caught watching porn, and they are completely flustered as to how to deal with the situation. And when I manage to calm them down and tell them, okay, this is what you have to say to the child, this is how you have to address the concerns of the child, this is how you can talk to the child, every every alternate parent, or almost every 2 out of 3 parents will turn to me and say, मैडम आप ही बात कर लो ना, आप इतने comfortably बात कर देते हो, हमसे नहीं होगा. And I can do that, I can have that conversation with the child, but you doing that conversation with the child as a parent will build a life connection for you with the child. So I always encourage the parent to have this tough conversation with their child themselves. It is difficult, and I'm willing to be part of the process and supervise the process, but it needs to be done by the parent with the child, so that that bond is built, that connection is built, because that is a bond that will last much longer than my consultations. So encourage as far as possible your parents to build that connection with their child, so that they are able to discuss these topics. They are able to throw up concerns and doubts and any sort of insecurities that they may have about the subject with their child. And it has to come from them. Otherwise, it will not be considered as valid or as real. For us as medical practitioners, we are bound by duty to address the concerns that our patient comes to us with. So we will do it. But it will help if the parent is part of the process, because they will be able to build a connection for life. So that brings me to the end of my prepared presentation. And at this point, if there are any questions, I will be happy to take those questions. Um, I think there was one question right at the beginning. It was shared right at the beginning of even before I started the presentation. I'll have to stop the sharing. Oh. So, Dr. Ghansham G. Patel has asked if there is any adolescent psychiatry courses offered for pediatricians at any institute in India. So this institute, there is no specific institute that offers courses for pediatricians, but there are a number of adolescent psychiatry courses that are conducted by PGI Chandigarh, uh, JIPMER, even NIMHANS and CMC. NIMHANS does the most amount of work in terms of knowledge building and skill building when it comes to psychiatry. So I would recommend that they have this VKN. They have a YouTube channel, Virtual Knowledge Network, and you could probably subscribe to that and look for specific updates about adolescent psychiatry. I know that they do definitely hold regular webinars and sessions on adolescent psychiatry. So if you're part of the mailing list, then you will get the information. You could send them an email on the website to register your interest, sir. I think that should help. Rajeshwari ma'am wanted the name of the book. It is Amazing You, Getting Smart about about your private parts. It's available on Amazon. I've actually given the hetero healthcare team a handout of books that would help as resources for parents to use as well as for pediatricians to use. So these are very basic, conversational usage books, not textbooks. These are commonly books that we recommend to parents, and this is something that could be suggested. I've also shared some links of useful articles and useful websites that could be used to gain more information about how to communicate about sexuality with children and teenagers. I've shared a Word file of the links, and someone from the hetero team will probably pass it on. Um, Dr. Shinde wanted to know, as a pediatrician, how to educate parents regarding the importance of sex education. Um, Honestly, sir, ma'am, it would be very difficult to, you know, in your day-to-day practice to do it on a routine basis. Okay, but having webinars like this, having programs, because you reach a huge population of parents, so maybe having awareness programs at the local, the local community level, or using school platforms, college platforms to address parents to discuss about why they feel sex education is necessary. I am telling you that a majority of the parents will agree with you when you say that sex education is necessary. The concern is who will do it, how will they do it, and what to do next. So, if you are starting with the process, I would also recommend training a few people or getting a few, maybe you could get psychologists, or you could get young doctors who are willing to spend the time to take these sessions where they are able to discuss concerns about sexuality and sex education with parents as well as children. Ideally, sex education should be done that way, where the child is spoken to and the parent is also spoken to, so that the same concepts go to both. And definitely, using social platforms might be a good way of connecting with the audience at a one-to-one level, even discussing, even asking general questions about the sexual development history of the child and whether there is any concern as regards sexual behavior that the parent has observed might prompt the parent to share their concerns with you, and that might, open that door to discussion. Dr. Anwar Khan has asked, how can a parent tackle a child's sexual curiosity in a healthy way without avoiding it? So my whole presentation was based on exactly this, that addressing the child's sexual curiosity in a healthy way is very important. And how you begin with it is, first, you gain the information that you need for yourself. And how do you gain this information? It's not about you learning about sexuality and sex. It's about you learning how to convey concepts to the child. So in the handout that I am sharing, there is this book called the Yellow Book by Tashi Publications. Now, this book, the Yellow Book, gives a very nice way for parents of children of different ages on how to talk to their child about sex. So it makes it very easy and it makes it very practical and understandable for parents. Of course, you can also, today there are a lot of videos and YouTube, there are a lot of websites that have resources which you and the child can watch together. So the parent would be educated to identify and find these resources and then engage in this discussion. So maybe the parent and child watch a video together and then they talk about it. We did this with Good Touch and Bad Touch for quite a few schools, and that really helped. So, where we screened a video about Good Touch and Bad Touch for the children with the parents present, and we let the children talk, and then we encouraged the parents to stay quiet while the children were talking. And then, as they were, discussing, the children also shared their doubts and questions, and then the parents piped in and answered. So it's important to, allow that kind of discussion to happen. So if you are able to, create that group discussion kind of a space, then that would be ideal. uh, Dr. Dhole has asked for, okay, the Nimhans channel is Virtual Knowledge Network. Nimhans, you can just, in YouTube, you can search for Nimhans and VKN and you will find the channel for YouTube that's available there. I think that has answered most of the questions that are already there. Yeah, so yes, fantastic question by Dr. Dole, that such parents and such patients do not come to us. Then should we ask questions? I don't believe it, sir, that such patients and such parents don't come to you. Every parent that comes to you is engaging in sexual intimacy. Every home that the child is growing up in has some exposure to sexual information, videos, material, or even ideas and thoughts that are cropping up in the child's head. I think it would be a good idea to start asking the question. So maybe you could just ask in terms of development. So while you examine physically, you can see that the child's development has proceeded at its particular pace. You can talk about whether the child is exhibiting any sexually explicit behaviors, any touching of genitals, any inappropriate behaviors in public, or is engaging in watching any particular YouTube videos, so that they are able to, at least understand that if there is a problem, if there is a concern, then there is a chance to discuss this with the doctor. So, yeah, you could probably start the discussion by asking the question. Yes, I agree. I agree, sir. So, sir has added that in rural areas, parents do not bother. I absolutely agree. But the concern is that even in rural areas, they grow into adults with primarily marriages and then later on turning into parents. So it might be a difficult question for parents in rural areas to ask and answer. But in simple language, very basic communication, it could be expressed to the parents that this is something that needs to be looked at. And just like you are looking at the child's physical development, emotional development, academic development, this is also one area of healthy development. In our childhood, nobody asked us these questions. We grew up with a lot of doubts and questions, and we answered our questions. A lot of our questions were answered during medical school. So it is important that this topic is talked about, whether rural, whether urban. It is important that the topic is talked about. I spoke about the camps that we had for teens that had come from rural areas of Maharashtra. And a lot of the teens were well aware of concepts of sex and sexuality. Today, with the internet, with access to information at your fingertips, there is no lack of knowledge. The knowledge is there. The children are bright and intelligent. Most of the times, the toppers come from across the state. So it is definitely not that the awareness is not there. If we as doctors and we as medical practitioners don't raise the query, they will not report it to us. So let's start by raising queries. Let's start by asking the right question. I think that was the last question, Yudhishthir.
I think that was the last question. I hope there are no more questions. Thank you, doctor, for making us understand. This is the most challenging topic. This was the most challenging topic, actually. It is actually a topic which creates an emotional bond between a parent and a child. And of course, it can be answered through or resolved through good communication. Awareness is very important, and beginning a conversation at a right age is very important, and continuing the conversation as the child grows is the best sex education strategy. And of course, we all must understand that sexuality is one part of life, it is not everything. And I think now, by now, as a doctors and parents, we should come out of this mental taboo of sexuality and awareness. So once again, doctor, thanks a lot for spending your time with us. Thank you.
It was a pleasure. Thank you.
Thank you.